What's going on, everyone? Welcome to our Monkeypox Situation Room daily briefing for July 20th, 2022. Let's just get started with where we stand today. As of now, we're approaching 16,000 cases. That's a far stretch from where we've been 2-3 weeks ago. I mean, as you can see here on the chart, it's pretty much going exponentially. In early July, we were just at 6,000 cases. So we're almost tripling the rate in just 2.5 weeks. That's not a great thing to see. In particular, today and yesterday were very bad days. I mean, that's the first time we've ever recorded 2 consecutive days with over 1,000 cases. And we like to look at trends, and usually Wednesdays are actually weaker days because not as many countries report these days. So today, I mean, we kind of broke the trend, I would say. Last Wednesday, we had 524 cases. The Wednesday prior to that, we had 246. And the one prior to that, we had 210. And as you can see, Wednesdays are the weakest days of the week. And it's clearly not happening this week, which is not a good thing to see. And it's kind of concerning that cases are actually rising even quicker than we thought they would. And the main jump comes from France, which recorded their weekly case number, which was 541. That's almost a 60% increase in just 1 week. Last week, they only reported 26% increase week over week. And the French government actually today said that a lot of these cases are catch up in their data, meaning that these cases would have been recorded in prior reporting, but they couldn't catch these cases on time. And if you ask me, that's actually a bad thing. Why? Because if you can catch these cases on time, you have a lesser chance of contact tracing on time, which means that there's a greater chance of further transmission. And this outbreak in France actually looks like it's going to get worse a lot because they cannot catch people on time, they cannot isolate them, and these people can go out and about not knowing they have this disease or virus and can actually infect other people. So not so great of news today coming from France. The highlight of the day today comes from Madrid. Today they recorded the first case in a 7-month-old baby that both his parents have the virus as well. So I mean, obviously this just proves to you that this virus is not just sexually transmitted disease and it can spread to close contact. And it's not good to see that a 7-month-old catches it. So hopefully we don't see a lot of it, but today not so encouraging news on that front. So what we have next tomorrow, the WHO is set to reconvene regarding the monkeypox and decide if this should be classified as a public health emergency of international concern. And if they don't do it tomorrow, then they should all go home and quit their jobs because, I mean, these cases have blown up in a very fast way. Last time they had a meeting was about 3 weeks or 4 weeks ago when we only had 4,000 cases, and they kind of dismissed the idea that it's a public health emergency of international concern. And now we're at over 16,000 cases. We see that these cases are kind of spilling out to other demographics. And in order to cause awareness, we need them to classify this as a global emergency. And if they don't do that, I mean, yes, we do have some awareness, but it's not enough, to kind of tackle this virus. And it's kind of too little too late. I mean, 16,000 cases later, they should have done it way before, but it's better now than never. So let us know what you think they'll do tomorrow. It's very interesting to see. I mean, if you ask me, if they don't do it tomorrow, then this thing is going to just spread further, and we just need to do something to stop it now, and hopefully they do it tomorrow. So just, comment below, let us know what you think. If you like this video, please subscribe. You can also follow us on Twitter, and we'll see you next time. Thanks again.